We are going to demonstrate each of the large OraPlace shapes today on Rob. We will start with the bar tool, which is designed specifically to target the upper and lower lips. Keep in mind the facial muscles often overlap and intercross. If you see that someone has an inverted upper lip where it rolls up, or an everted lower lip where it rolls down, this is because of tightening of the musculature in these areas. You may find that if the patient has a severely inverted lip, there is not much space to get a tool in there, so when you begin treatment, you may need to work the corner areas first until you can get down under the lip. To target the upper lip, place the tool underneath the lip to provide a nice, easy stretch. Okay, Rob, go ahead and turn your head to the side. Is this uncomfortable? Is this painful? The patient should not experience pain or discomfort during this stretch. Our goal is to have this in as long as possible. Depending on the patient, they can sit and hold the tool in place, or we can hold it for them. Sometimes it will stay in place on its own. Okay, moving to the lower lip area. If you have difficulty slipping in the tool, gently grab the side of the lip with your other hand and then push in the tool. Once in place, the stick may touch their nose, but again, you'll see the stretch here. So go ahead and turn to the side. Now this is important to think about when you use these tools. Even when stretching down through here with the bar-shaped tool, it is also slowly impacting the platysma. The platysma muscle is a muscle of the neck that inserts right about here. By stretching these muscles, you're pulling the platysma up, and you're going to see secondary effects down below the chin. Our second tool is the ball shape. The ball shapes are intended for the area of the modiolus, up to the nasolabial folds. The modiolus is the point lateral to the angle of the mouth where several facial muscles converge. Also note that the ocular muscles, when contracted, can pull the eye downwards. By placing the tool high in the oral cavity, it will stretch those muscles as well. So let me show you on Rob. Open up, and now close. You can see that I can control the pressure depending on how much stretch I want. Now to stretch the modiolus, you can place it right here. You can move it back a little too, but generally we want it right at that modiolus point. It's more effective if the patient can keep their lips closed. So go ahead and turn to the right so we can all take a look at that stretch. Okay, open again. We're going to target now up by the nasolabial folds. The stretch is harder to see, but if you compare left to right, so go ahead and turn your head from side to side, you can see how much flatter it is on the right side of his face where we're not stretching. Okay, go ahead and open up. Lastly, we will look at the boomerang shape. It is specifically angled to go along the bottom of the jawline, and it flips upwards to target the cheekbone area as well. So this area and up in here. For a more intense stretch, you can turn the bottom edge outwards. This one I like to twist as I put it in. All right, so go ahead and open up, Rob, and we're going to target the bottom of the jawline. You can see the nice stretch there. Go ahead and turn to the right. Okay. Now, again, if I want to, I can turn that bottom edge outwards to intensify the stretch. Now let me show you up on top. I'm going to go ahead and insert it again, and I'm going to twist it upwards. So you can go ahead and see that nice stretch there. You can also use the tip of the boomerang shape pointed outwards to target the modiolus if the patient's opening doesn't allow for use of the small ball shape. So that looks like this. And you can see that nice stretch. One thing to keep in mind is that just because you're using the large shape, the large size of one shape does not mean you need to use the large size of the other shapes. For example, you can use a large bar shape and a small boomerang shape.